Infant is defined as a live infant born before the end of 37 weeks. So, before magtapos ang 37 weeks. Okay. What is the maximum birth weight allowed for an infant to be categorized as preterm? Less than 500 grams to 2,500 grams. Maternal risk factors for preterm include smoking, poor nutrition, placental problems, and incompetent cervix. In RDS, what's causing alveoli to collapse? So surfactants is lacking, so it causes the alveoli to collapse. What is the most common cause of death in preterm infants within the first 72 hours of life? RDS. What specific respiratory rate range should be maintained during interventions for an infant with RDS? What specific respiratory rate should be maintained during interventions for an infant with? So kailangan is, ang normal is 30 to 60 breaths per minute. So kailangan mo ma-maintain 30 to 60 breaths per minute for RDS people. Children, preterm babies. So why is preterm infant with RDS placed on NPO nothing for ORM status? Because it is at risk sila for aspiration. How is artificial surfactant administered? So in the tracheal tube. TTN is characterized by a respiratory rate of up to how many breaths per minute when crying? About 80 BPM when crying. Actually, hindi ko talaga siya to na putumahin, pero grabe na memory. So beautiful. In TTN, the respiratory rate typically shows 30 to 60 within how much time after birth? 72 hours. 1 hour after birth. So 30 to 60 na siya. Normal man, 30 to 60, diba? After birth. So, kailangan natin malaman ng normal values. No? What mode of delivery is considered a predisposing factor for transient takip niya in newborn? Mode of delivery considered a predisposing factor. CS. As well as, sa pailain ng mga factors na makakause uguan katong excessive nga fluid sa maternal fluid. Takip niya syndrome of the newborn is usually peaks at 36 hours and phased by how many hours? 72 hours. Itong 72 hours, 1 hour. Ang RDS, so 1 hour. Apnea is, in a newborn's clinical defined as pause in respiration, 20 seconds. Apnea lasting less than or equal to 50 is considered normal. True. Which medication is administered to stimulate breath breathing in an infant's experiencing apnea? Bronchodilator, theophylline. What's the spelling? Theo, densiphylline, double L, L-I-N. What physical stimulation methods can be used to encourage a preterm infant to breathe during an apnea expel? Gently shaking or flicking the sole of the feet. So, in apnea expel, so, may buhaton sa mga nurses, yung gentle flicking the sole of the feet. Why are preterm infants at high risk for hypothermia? Because of the lack of subcutaneous fat, small muscle mass, and absent shiver or sweat mechanisms. What skin assessment findings associated with hypothermia in a preterm infant? Mottling. Until what gestational age range do infants typically have weak suck, 33 to 34? Which feeding method is used if preterm infant has a poor suck or swallow reflex to prevent aspiration? Preemie. Cabbage feeding. Why are preterm infants more susceptible to infection? Sepsis, neonatal. Because infants are having less immunodeficient sila, they lack the IgG, which is transmitted through the placenta in the third trimester. IgG and immunoglobulin. They have immature immune system, during which trimester does maternal immunoglobulin normally cross the placenta to the fetus, third trimester, which is the primary cause of intraventricular hemorrhage in preterm infants. So, ito bitaw reason nga kuan sila. Ano? Hemorrhage in infants. Rupture of fragile brain capillaries. Rupture of fragile brain capillaries. Rupture ang brain capillaries due to skull compression. So, sobrang compress ang skull, no? Ruptures siya. Which vitamins administered to preterm to prevent hemorrhage because of immature clotting factors? Vitamin K. What assessment? So, kailangan na mag-provide og vitamin K ha sa kung na-ay hemorrhage ang to prevent hemorrhage, vitamin K. Kay compression magud siya. Nagka-compression ka ba sa iyang head? What assessment findings involving the head is indicative of intraventricular hemorrhage? Katong nitong nga picture, bulging fontanelles. What is the normal gani nga fontanelles, anterior and posterior fontanelles kana sa close? Hyperbilirubinemia, and comment down below. Hyperbilirubinemia in preterm infants is caused by excessive bilirubin due to RBC breakdown and an immature liver. How far should the phototherapy light 18 inches during treatment? What two areas must be covered on a baby? Young eyes and genitals. ABO incompatibility occurs when the mother has type O blood and the fetus has AB or B. Why does the ABO incompatibility not occur in pregnancy? Because the what type of it? Antigens or antibodies which destroy fetal red blood cell cannot pass through the placenta, and during the birth pa siya makapass through. The maternal antibodies are too large to cross the placenta. Jaundice occurs within the first blank hours of life is a key assessment for ABO incompatibility. First 24 hours of life. So what is the difference between pathologic jaundice and physiologic jaundice? What are the clinical signs of kernicterus in a newborn? Comment down below ha. Ato. What are the clinical signs of kernicterus in a newborn? So kernicterus is a brain problem when the bile enters the brain, something. Absent moral reflexia. Okay, absent moral reflex. Ang assessment nimo, clinical signs for kernicterus, absent moral reflex, apnea, high pitch cry, opistotonos, tremors, and seizures. Opistotonos. Retinopathy of prematurity is primarily caused by exposure to high levels of which substance? Oxygen. To prevent ROP, what is the target range for sa ito pagbasa na PaO2 in preterm infants? So katong 50 to 60%, 50 to 70 mmHg. A post-mature infant is defined as being born after how many weeks of gestation? 42 weeks. What skin characteristic is commonly seen in post-mature infants due to placental inefficiency? Itong lesser-like skin. Because wala na sila lanugo. The lanugo increases when nag-decrease with age. What substance is often absent on the skin of a premature? Vernix. vernix di ay dili lanugo. So differentiate between vernix and lanugo, guys. Hypoglycemia in unit is managed with an IV glucose infusion of what concentration? 10 to 25%. Hypoglycemia is managed by IV glucose. So, kabalo ka ni, infusion. So, kailangan mo tagaan og IV infusion ng 10 to 25% ang baby ani. So, which movement assessment is characteristic of neonatal hypoglycemia? Unsa ang assessment for characteristic of neonatal hypoglycemia? Okay, so kung naka-hypoglycemia, the patient is jittery or jerky movements. Meconium aspiration syndrome is suspected as if the amniotic fluid has what color? Meconium aspiration syndrome, suspected siya if the amniotic fluid has yellow or greenish na color. Small for gestational age infant is defined as being smaller than usual for their age, gestational age. SJ infants are at risk for polycythemia, which is reflected by laboratory finding? High hematocrit. Small for gestational infants at a risk for polycythemia. So polycythemia, muna siya, daghan kay kag red blood cells is reflected by what laboratory finding. So ang SGA nga daghan siya red blood cells ay high hematocrit ay ang polycythemia to fight off certain things. Large for gestational age infants, so kailangan comment down below po ito kayo kagets. Large for gestational age infants are those with a birth weight greater than how many grams? 4,000 grams. So normal diba is 2.5, di ba? So number 4K. LGA status is defined as a birth weight above which percentile? 90th. What maternal condition is a major predisposing factor for delivering an LGA infant condition? Maternal condition a major predisposing factor for delivering an LGA infant. For the controlled maternal diabetes. So, kung naay diabetes, it could be SGA ang infant. Kung naay increase in maternal weight, it's large. Kung naay hypertension, it's more gestational age. Which birth injury is associated with an absent moral reflex on the affected side? So, nakabalo tayo ganina ng absent moral reflex and napatay ubang factors is an indication of what? So, itong absent po yung moral reflex. Comment down below kung nakalimot siya. Which birth injury is associated with an absent moral reflex on the affected side? Kani sa unaffected side, so fractured clavicle. Duchenne palsy involves damage to which cervical nerve roots, C5 to C7. What is the characteristic arm position in an infant with Erb's palsy? Dili ni Clohans. Kay Clohans is katuning Klomke. So, unsa may characteristics yung arms? Arm adducted and elbow extended. Arm adducted. So, adducted is palayo, di ba? Ang adducted kay paduol. And elbow extended, so nakapagawas ang elbow. Which birth injury presents as claw hand? Klomke paralysis. C7 to T1. Phrenic nerve palsy in a newborn results in an elevated diaphragm on X-ray. Phrenic nerve palsy is common in children between which ages? 6 months to 36 months. What type of appearance of tympanic membrane in a child with acute otitis media? Ano na akong acute otitis media ang child? Red and bulging. Ang iyahang tympanic membrane. Acute lang. How long is the typical course of amoxicillin for treating otitis media? So, kanina wala ko kabalon sa treatment for otitis media. But it's 10 to 14 days. What is the name of the surgical incision made in the tympanic membrane to drain the fluid? Tympanostomy. Merengotomy. So surgical incision made in the tympanic membrane to drain the fluid is merengotomy. So napani siya katong to keep it. Tympanostomy is to keep it open. Tubes are designed to ventilate the middle ear and typically stay in place for how long? The tympanostomy tubes designed to ventilate the middle ear stays within 6 months to 12 months. What precautions should be taken during bathing for a child with tympanostomy tubes? Is mag-ear plugs, but it is best advised that we do not allow the child to swim. Conjunctivitis is an inflammation of which part of the eye? Sa iyahang lower conjunctiva. Before applying eye medications for conjunctivitis, what should the nurse use to clean the eye? Cold water. Strabismus is a misalignment or uncoordination of the eyes due to muscle coordination issues. Uncoordination of the muscles. Which type of strabismus is characterized by eyes crossing inward? So, inward is isotropion, exotropium outward, hypertropion upward, hypotropium. Hypertrophy is down. Isotropia. Hypertrophy is a form of strabismus, isotropia, where the eye misaligns in which direction? Upward. To prevent amblyopia, surgery for strabismus should ideally be done before the child reaches what age? 2 years of age. Amblyopia or lazy eyes results when the brain suppresses influence from an eye affected by untreated strabismus. In occlusion therapy for amblyopia, which eye is patch, of course, the unaffected eye, which is the strongest eye, is ato siyang patch so that the weak eye or the lazy eye can work harder enough. What position should a child be placed in during a nosebleed? So the child should be placed upward and inward. Tilted forward ang head. What is the major assessment sign for tonsillitis besides pain? Assessment sign for tonsillitis is difficulty swallowing, drooling, or enlarged kissing tonsils. Tonsillectomy should be performed while the child has an active infection. No? Why? Sa reason, Ana, comment below. What postoperative position is recommended for a child following a tonsillectomy to prevent aspiration? Again, so lax position of the limbs due to immature muscle development. Maternal risk factors. This includes smoking, incompetent cervix, and poor nutrition. Mudi na akong gangahan na nourished ta. So, na siya poor nutrition and placental problems. So, etiology of preterm infants, other risk factors are economic, and exposure to environmental stimuli, harmful substances, low socioeconomic status. Differences between term and preterm newborns. So we have, how many is it? 8. So, yahang male genital, female, kill to toe, heel to ear rather than katong resting posture. So 7 di ay guys. 8 na. 8 tama 8. Resting, wrist flexion, recoil of extremities, heel to ear, sole, plantar creases, breast, ear, at male genitalia, female genitalia. So for resting posture, ang preterms are more flat on their backs, while terms are more flexed, wrist flexion. Okay, so ato na nang i-go over karon. So 7 kabuka. Difference between resting posture, na-discuss na nato, minimal flexion in upper extremities, partial flexion in the lower extremities. So muna sa free term, minimal and partial lang ang flexion, while sa full term we have flexion on all extremities. So wrist flexion, unsay naa diri? So kung pre-term 90 degrees ang iyahang flexion, while term is possible flexion of the hand and to arm. So hand to arm iyahang makan. So karon wrist flexion 90 degrees ra ang sa pre-term, whereas sa term kay on the hand to arm jud siya. So recoil of extremities. First, imuhang i-flex ang legs sa iyahang knees, hold for 5 seconds, extend the legs fully by pulling the feet and release. So kung muna ni siya recoil of extremities ang katulo. So more flex lagi ang term. Briskly full flexion, while minimal is response, absent ang response. So mo tong ginatawag nato nga unsa to na recoil of extremities. So heel to ear. Baby is nakasupine, hips position flat on bed. Draw the baby's foot as near to the ear as goes without forcing it. Observe the distance between the foot and head as well as the degree of extension sa at the knee. Very little imuhang visualize nimo no. So ako sang wait lang. So preterm, very little resistance will be met. Mark resistance, impossible to draw the baby's foot to the ear. So the sole plantar creases, there will be more creases or visible creases in the full term, while sa preterm there will be none. So shiny kayo ang tiil sa full term no. So atong i-recall back on sa atong na-discuss na. So atong na-discuss is resting posture, wrist flexion. Number 3 would be the atong flexion gihapon. And sole creases, breast tissue, then male and genital areas, female. Ito sa recall kadali ha. Recoil of extremities, tawag, heel to ear. And sole plantar creases. Breast tissue, dili daghan kayo for less than 32 weeks, mga ganun bitaw. So younger than 34 weeks, areola are, the nipples are barely visible. So dili kayo makita ang areola kung gamay pa siya sa 34 weeks. After 34 weeks, however, ma-raise na ang areola. Then less than 36 weeks, no breast tissue. Wala dyan breast tissue makita kung gamay pa sa 36 weeks. So kung 39 weeks to 40, muna siyang sa term, breast tissue is 5 to 6 millimeters and will increase with age. So differences between term and preterm newborns sa ears. So we have breast tissue, then we also have sa ears. So wala kaya ta nakakuan ani no kaning ears nga naapil pud ni siya, pero as sa preterm kay ang ears nila is more dili siya kanang curvature bitaw hard. So before 34 weeks nakabalutan na wala di ba na dili kayo makita ang areola. So 34 weeks after makita na nato siya ni raise dayon sa ang breast tissue sa 36 weeks kay visible na din. 39 to 40 weeks kay 5 to 6 millimeters na kadako ang ang term ang iyahang ang breast tissue. Well, before sa 34 weeks, ears are very flat and relatively shapeless. So shapeless ang iyahang ears no. Then 34 and 36 weeks, slight na curving superior part of the ears. What's a term kay in curving of 2/3 of the pinna, and after 39 weeks kay mo continuous na siya to the lobe. So 2/3 sa pinna kay nag-incurving sa ears. Well, so before 34 weeks, shapeless pa jud ang ears. So male genitalia, we have what we call here cryptorchidism, where the testis is undescended. So for male genitalia, muna siya. Including po diri sa male genitalia is ang rugae. So sa preterm kay kamay ra og rugae sa scrotum, while sa full term kay daghan kay rugae ang develop. So testes are lower in the scrotum. So gamay lower kayo ang testes no sa scrotum sa full term, while ang preterm kay testes are very high in the inguinal canal. Difference between term and preterm newborn. So female genitalia, more clitoris is observed, while sa dire sa gawas sa full term kay ang female genitalia natabunan jud ang clitoris. So ang sa preterm ang clitoris kay kuan siya ba kanang visible, while the labia majora sa full term was na-cover na siya labia majora. So prominent kaayo. Etiology of respiratory distress syndrome and why. And sa may ang RDS is because of the lack of surfactant, which causes the lungs to collapse in newborn. So ngano man na aga ni RDS because of lack of surfactants. with each expiration. Is common cause of death RDS within the first 72 hours of life. Assessment, how do we assess RDS? So we can know nga na siya RDS if ang patient has grunting, tachypnea, tachycardia, nasal flaring, chest wall retractions, and cyanosis. Siso ang respiration. Cyanosis, chest wall retractions, no? Knife retractions, curvature. So how do we intervene with RDS? We provide patient with what? We treat RDS. Mag-oxygen ta, oxygen therapy. Pero na ito pasubrahan kaya mag-return ng palita. No? Put the patient on NPO. So number 1, ipa-NPO dyan na to siya para ma-avoid siya aspiration. So mag-administer tag oxygen therapy muna na mag-iingon. Number 2, panay na siya. Assist in inserting an ET tube. So as a nurse, mag-assist ta para i-ET tube ang bata. And through the ET tube, maka-instill ta tira og artificial surfactant. So mag-maintain na to iyang respirations between 30 to 60 beats per minute. And assess na to siya every 1 to 2 hours. So first ipa-NPO dyan na to siya. Dayon administer tag oxygen, ET tube. Dayon magbutang tag surfactants through the ET tube. Dayon maintain na to iyang respiration between 30 to 60 and i-monitor na to siya 1 to 2 hours as needed. So rapid respiratory rate up to 80 beats per minute when crying. So when crying, ang iyang RR maabot siya 80. So within 1 hour mo slow down na gyapon na siya to 30 to 60. Transient tachypnea in newborn. So muna siya titian na diay ni. Ang 180 pumuhilak siya 80 iyang RR. So peaks in intensity at 36 hours of life and then begins to fade. Yeah, by 72 hours is spontaneous TTN. So sa 36 week of hour of life mo, week ba to? Hours of life mo, kuan siya mo intense kayo ang abot na sa 36. Muna siya intense kayong TTN guys. Then mo fade raman pud siya especially after 72 hours. So additional 1 day, diba? 36 plus 24. Mo ba? Sama na may 72 minus 36. Comment down below sa answer. Rapid respiratory rate up to blank. When blank. So up to 80 when crying. Within 36 hours slows to peaks in intensity at 36 hours of life and then begins to fade. By 72 hours it spontaneously fades. So begins to within 1 hour slow down po siya to 30 to 60 ppm. So pero 80 RR dito when crying. Causes of TTN, so CS dayon daghan og maternal fluids. Ay, dili da ito. Unsa tong CS? Slow absorption of lung fluid ay. Nga namang slow absorption of lung fluid kay ang lungs nga fluid sa lungs sa baby na sobra kay i-absorb man gud siya sa body na lang. So walay nahitabo slow ang absorption. So slight decrease in mature surfactants. So gamay na pala surfactants no, so mo causes it increase are to better use the surface available. Kay gamay man tag surface area. So muna siya no, slow absorption of fluid, decrease in mature surfactant, and decrease alveolar surface area. Predisposing factors mo na ni siya ang CS maternal fluid, receive extensive fluid administration during labor, and prematurity po di ay. Prematurity ako nga ibalan. So, complications of TTN, so kato, tiring effort, mild retractions, mga retractions po dahil basta na TTN, no? Mild hypoxia, difficult feeding. So, makakapoy kayo ang iyahang effort kay liman ka 30 beats ka magkilap, no? Tiring kayo. And magka-difficulty feeding ang bata anak. Dayon. Magka-mild retractions po siya, mild hypoxia. So interventions for TTN is of course oxygen administration, close observation that increased effort is not tiring. So to observe nga nagdako iyahang effort, make sure na to siya nga dili kapuyan ang bata. So watch out for na to siya for respiratory obstruction. So oxygen administration. Pause in respiratory longer than apnea can be sign of sepsis, seizures, upper airway abnormalities, gastroesophageal reflux, hypoglycemia, or impaired regulation of sleep or feeding. So mo siya ang kuan gihapon kaning apnea. Apnea is associated with what? Apnea is associated with kato mga prematurity, sepsis, cyanosis, marked pallor. Magka-cyanosis pa rin mag-apnea, no? Of course, mag-blue ang bata na wala kay oxygen sa lawas. Marked pallor, so mag-pale ang baby. Hypotonia, tas hypotonia means may muscle, man siguro ni siya. So, dilihok ang bata, and bradycardia, kamay ang iyahang cardia. Rhythm. Causes of apnea, so may reason nga nag-apnea ang baby. So, I feel like naibalaan na nini mo, but you have to recall, what is the cause of apnea? Anong magkalisod, dili mga ginhawa ang bata? So, fatigue, immature respiratory mechanisms, and secondary stresses, infection, hyperbilirubinemia, hypoglycemia, hypothermia. So, major reason due kay fatigue mo na. Immature respiratory mechanism. Secondary stresses of apnea, hypoglycemia, hypothermia. So, yes, hyperbilirubinemia, infection. HI3H. Hyper, hypo, hypo. So secondary stresses na siya. Immature. Apnea is to immature. Immature respiratory mechanisms. Interventions for apnea, guys. How do we intervene with apnea? Gentle flickle na to ang bata, gentle shake or flickles is also fit sa baby. So stimulate the baby to breathe again, and also we can resuscitate. How do we perform resuscitation? And we also have this medication which is a theophylline, which is a bronchodilator. So na-answer mo to siya pero kailangan mo siya complete na theophylline. So how do you stimulate the baby to breathe again in apnea? So okay, again, so how do you stimulate the baby to breathe again? We have bronchodilators, we have theophylline, we have gentle flick or shake the baby gently or flick the foot of the baby. Then we also have resuscitation. How to prevent apnea? So ano to siya pag-prevent, no? Maintain a neutral thermal environment. So it's a relationship sa kainit or sa temperature sa iyang inability to breathe properly. So excessive fatigue, gentle handling. Fatigue man jud ang gentle handling lang, avoid excessive fatigue. So gentle handling lang. So ang baby dili maginhawa kung grabe kaayo ka mag-handle sa baby. So kailangan gentle lang siya. Always suction gently and burp after feeding. So that's how we prevent apnea, burp after feeding, gentle handling, and always suction gently. And maintain a neutral thermal environment. Etiology of hypothermia. Lack of sa baby, lack siya og subcutaneous fat as well as lack po niya kay ang shivering or sweating mechanisms. Small muscle mass. Small po yung muscle mass. So hypothermia assessment, how do we thermometer or axilla? Mottling. So kung naimotling ang baby, it could be an indicator na pula-pula, no? It could be an indicator ba nga, hala, tunaw din yung baby ba? Ang hypothermia na siya, kinag-mottling. Takip niya is, paspas iyang ginawa, guys. So kung relationship yata sa RR o hypothermia, no? Increased activity and increased crying. So to compensate for the hypothermia, kay mag-try og liho kaayo ang baby. An increased crying po kay like, oh no. So mo to siya ang assessment. Interventions for hyperthermia. Place the infant under a radiant warmer kana hypothermia radiant warmer na to na siya. Assess the infants for 2 to 3 hours. Dayon warm the equipment with linen before contact with infant. So etiology aspiration kay weak iyahang sucking reflex, sucking or swallowing reflex which magdevelop siya 33 to 34 weeks pa. So until the 33 to 34 weeks gestation. So weak siya until maabot ka sa point na 30 to 34 na siya. Dili na siya weak. So poor pud siya og cough reflex. Dili siya ka-cough. So interventions for aspiration, we have burp pa na itong baby. Sa itong mga kailangan na ito i-burp ang baby sa food field. So monitor suck or swallow reflex to assess the risk of aspiration. If poor gavage feeding as indicated, use preemie nipple. So kailangan na ito monitor suck or swallow reflex sa baby. So i-gavage feed na to siya if di makaya. Use a preemie nipple if bottle feeding. So preemie nipple lang ito, no? Ipa-burp po na ito diri. Tama. And assess for abdominal distension and emesis. Kung naba siya ay abdominal distension or emesis, ano di ay? Aspiration, intervention, ano di kung nagsige siya suka-suka. Okay, ma-aspirate siya, makaon niya yung sinuka, guys. Etiology of infection, say reason nga nung na-infection, weak ang immune system sa baby because of lack of immunoglobulin IgG from the mother. So infection assessment, how do you assess sa infection kung na-lethargy ang baby o hypoactivity, redness or ang sucking niya. Redness or sucking o hypoactivity. So infection, intervention sa infection, i-increase na to ang iyahang kuan, di ba? I-increase na to iyahang immunoglobulin, liquid. Provide antibiotic therapy. Adhere to aseptic protocol. Administer autotherapy. Monitor VS and activity level. So kailangan na to i-provide ang antibiotic therapy. So kung infection, antibiotics rin na siya. Adhere tag aseptic na protocol. So pawala sa mga bacteria, no? Then administer po tag oxygen sa baby. Monitor VS activity level. Etiology of hemorrhage, ni-rupture ang sa capillaries, thin fragile capillaries within the ventricles of the brain. Dayon wala po tayo production of clotting factors immature, so that's why we give administer taog vitamin K. So assessment sa hemorrhage, jittery crying, convulsions, lethargy, dali na lethargy dahil bulging fontanelles. Ayun kalimting akong kung na-hemorrhage, nag-bulge sa mga fontanelles. So again, kana sa ganitong normal na close ang anterior posterior fontanelles, and then we also have bulging fontanelles and bradycardia. Ano mag bradycardia man kung nag-hemorrhage? Comment down below. Inactivity or unresponsiveness, nearing unconsciousness. Lethargy, hemorrhage. Hemorrhage, interventions, oxygen pa mo siya, blood transfusion, exchange transfusion, monitor for signs of hemorrhage and administer vitamin K. unsa dito mag-exchange transfusion? Kung saan na exchange transfusion kay kung hemorrhage imo man taga vitamin K ug imo siyang i-monitor for signs of hemorrhage. Excessive amounts of bowel pigment, hyperbilirubinemia. Etiologenia is immature ibang liver. Yeah. Difficulty in eliminating bilirubin released by normal breakdown of red blood cells. So hyperbilirubinemia assessment includes so how do we assess hyperbilirubinemia? Jaundice and dark tea colored urine. So kung i-assess nimo hyperbilirubinemia kay nakay jaundice no ug dark tea colored sa urine. So interventions for hyperbilirubinemia provide phototherapy. So phototherapy ka 18 inches, regularly turning to sides every 2 hours, promote feeding and hydration, and give water in between feedings. So, kaning hyperbilirubinemia kay, di ba, naglisod tag kuan ani kanang pawala sa bilirubin sa RBCs. So, kung mag-provide tag water, makatabang ba siya? Yes, kay makatabang ba siya expel sa bilirubin? Question na siya. Regular turning to the side every 2 hours. So, mag-phototherapy man diba, then 18 inches ang baby cell light. So, kailangan ito siya turn every 2 hours.